From Vermont Public, this is The Frequency. I'm Mary Engish. It's Monday, May 19th, and here are today's headlines. The Trump administration has terminated a federal grant for infrastructure projects in Northwest Vermont. Towns in Franklin and Grand Isle counties had been set to receive almost $900,000 toward projects to get people outside, like building sidewalks, bike paths, and trails. The grant was supposed to be directed toward rural communities. Catherine Dimitruk leads the Northwest Regional Planning Commission, which was overseeing that grant.
We have 2 rail trails in our region, and once you build connections to those in our rural towns, like you have, another 110 miles of trails you can get to. So it's really, really disappointing.
Dimitruk says they still have $15,000 in expenses they can't bill for because the government has blocked access to the reimbursement request system. More than 200 Vermont families have parents who are in the country without authorization, but children who are U.S. citizens. As Vermont Public's Peter Hirschfeld reports, lawmakers want to make sure those kids don't end up in state custody if their parents are detained or deported.
Legislation that's on its way to the desk of Republican Governor Phil Scott would help undocumented parents make what's known as standby guardianship arrangements. South Burlington Representative Martin Lalone says the bill allows parents to file key court documents well in advance of their arrests, and he says it would empower courts to honor the wishes of detained parents who aren't able to participate in court hearings.
It allows families some peace of mind, knowing that there's a path to put into place their plans to keep their children safe and in community care.
Lawmakers drafted the bill at the request of nonprofit legal organizations that provide services to non-citizen Vermonters. For Vermont Public, I'm Peter Hirschfeld.
The state is dedicating $22 million in federal Solar for All funds to affordable housing projects. Vermont Housing and Finance Agency will use the money to finance rooftop solar on affordable housing developments. Mia Watson is with VHFA. She says the funding will serve both low-income renters and homeowners, but
it's always been really difficult to make solar accessible to renters in general because they don't have control of their own roof space.
Watson says historically there has not been funding to put solar on affordable housing. Program guidelines require the solar projects deliver at least a 20% reduction in electricity costs for residents. Watson says if rooftop solar doesn't work for a building, VHFA will use the funds to help people access community solar instead. And even with a wet start to spring, the state's Environmental Conservation Department warns against burning brush as it could quickly get out of control. DEC officials remind Vermonters that any open burn requires a permit from your local fire warden and to never burn trash. And before burning any debris, folks should check on wildfire conditions. Last year in Vermont, WCAX reports that 96 wildland fires were all caused by human activity. Coming up, Mike Smith is often the person who gets called when a private institution is in trouble. Now he's looking into the University of Vermont Health Network. That's after this. When a public or private institution is in trouble, there's a decent chance that Mike Smith might get a phone call. The former Human Services Secretary has been tapped to help troubled institutions from Burlington College to Fairpoint Communications. The Green Mountain Care Board, that's the state's healthcare regulator, recently asked Smith to lead a review of cost effectiveness of many programs at the University of Vermont Health Network. Vermont Public's Bob Kinzel sat down with Smith to discuss his new oversight role and the challenges facing Vermont's healthcare system.
You've got a lot of experience in state government dealing with healthcare. Let's step back and take a look at the overall condition of Vermont's healthcare system. I'd love to get your thoughts on that. Some people think we're really at a tipping point now, that unless some major changes are made, this system is in dire financial shape. What do you think?
I think they're correct. I think we're in a perilous situation right now. We have issues with affordability, we have issues with quality, and we have issues with access. And I think, those are really at a precarious point at this point. I mean, we have our largest insurer who's in financial problems. We have costs that we can't afford in our healthcare system, especially in hospitals and other areas as well.
Do you think we need to rethink the role of our 14 hospitals in the state and whether or not Vermont can financially maintain this many hospitals?
Yeah, I do. And one of the things that obviously is part of the charge that AHS, the transformation that AHS is looking at right now, is how to do that. And that doesn't necessarily mean closing down hospitals. It may mean changing their role in some ways in various places. But I think, as the Oliver Wyman report pointed out, we have a serious problem in this state in terms of trying to finance as many hospitals as we have. And therefore, I think we need to look carefully on how do we sort of reconfigure this healthcare delivery system, not eliminate it, but how do we reconfigure this healthcare system in order to make it viable and cost effective?
You mentioned that there's some other states that have the same demographics that Vermont has, but don't suffer the same kind of increase in healthcare costs. What are they doing that Vermont's not doing?
Well, I'm going to be looking at that as we move forward. I don't have the silver bullet for you on this one, but it is certainly something that I'm going to look at and understand what they're doing. Maine, for example, may have lower costs than we do. What are they doing differently than we are in Vermont? That's one of the questions I'm going to be looking at as we sort of delve into this as a team. What are other states doing that we're not doing?
I mean, when we talk about costs, we have administrative costs, we have just the cost of providing that care. You wrote a letter that was pretty scathing about the leadership at the UVM Health Network in terms of them getting some pay raises at the same time that they were making some healthcare cuts. But aren't the administrative costs really just a fraction of the whole?
Well, they're a part of the whole. I wouldn't say they're a fraction of the whole. They're a part of the whole. Part of my charge is to look at those administrative costs, see where they are. But they're millions of dollars. Administrative costs are millions of dollars. It all depends on how you cost allocate the various costs within the healthcare system, and that's something we're going to be looking at. There are perhaps savings in those administrative costs that could help us in the cost of delivering health care in this state. I intend to look at it. We intend to look at all costs. There's the delivery of sort of the healthcare costs and the delivery of the administrative costs as well. And where can we find savings? Where can we be more efficient? Where can we be more effective?
Do you think Vermonters are going to have to accept some realities about their future healthcare system that might be tough to accept?
I think what Vermonters really are after is equity across the system in terms of if one state is paying lower, why are they paying lower versus in healthcare costs versus Vermont? I think that's what Vermonters are looking at.
Mike Smith, many thanks for sharing your thoughts about the future of Vermont's healthcare system.
Well, Bob, I appreciate you having me on, and thank you very much.
Thanks for listening to The Frequency today. We had additional reporting from Lexi Krupp, Peter Hirschfeld, and Abigail Giles. Today's episode was edited by Karen Anderson and Liam Elder Connors. And our music is by Blue Dot Sessions. I'm Mary Angish. Talk to you tomorrow.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you were going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.